Coming up on the Doctors Hospital podcast.
One of the big things that's coming down the pipe would be artificial intelligence, so AI. There are tools available in the AI space that will allow us to improve our care delivery.
Your health just got brighter with Lamp Insured. Sign up for our Lamp Insurance Supplement Plan and enjoy copay waivers and complete access with no upfront ER or inpatient collections. Only $30 per month. Visit doctorshosp.com/lap to sign up or contact 822-1009. Your journey to affordable and worry-free healthcare begins now.
Welcome to the Doctors Hospital podcast. I'm your host, Alexis Burrows, Marketing Director here at Doctors Hospital. And today we are joined by internal medicine physician and chief medical officer here at Doctors Hospital, Dr. Sheena Antonio-Collie. Welcome to the show.
Thank you, Alexis.
And today what we want to do is shine a light on specialist care as provided in the healthcare system, particularly here at Doctors Hospital. And one of the things, we've been, I think, back in doing the podcast for about 2 months now, and we've had a wide range of physicians and different members of the health system come through the podcast and talk about a lot of different things. And one of the core principles that seems to continue to come up in those conversations is the importance of multidisciplinary care and the critical nature of having multiple specialists within a healthcare system, for especially when you start to deal with more complex care issues. So we wanted to get you on the podcast to talk about specialty care, why it's important, the role it plays in someone's overall health, and what that looks like. So I want to peel back a little bit first and start with just kind of, getting an idea and understanding of who you are, the role you play in the health system before we dive into looking at specialist care. So for a lot of people, they may not know, what is that role of a chief medical officer within the health system? What does that mean? And how does it relate to ensuring access to not just care, but specialist care?
Okay, thank you so much, Alexis, and thank you for that question. So, the chief medical officer of any health system is the is the clinical leader
Mm-hmm.
in that space, and so that person is responsible for clinical processes, for quality assurance,
Mm-hmm.
quality improvement. That person is responsible for anything to do with patient care,
Mm-hmm.
in terms of access. What a chief medical officer would want to do is to ensure that the patients that that the health system serves
Mm-hmm.
have access to the health system
Okay.
and all of the services that are inherent to that health system. And if indeed there are services even that are not provided by our health system, to be able to enable access to that service that the patient requires. So in terms of access, the chief medical officer really takes the lead in strategizing
Mm-hmm.
and ensuring that patients get the best care that they can get. And definitely that includes access to care.
Okay. And so what that sounds like is, I imagine, a mix between recruitment of specialists that may not currently exist in the space, as well as bridging the gap between where maybe it's not even offered in country, but
Correct.
bridging that gap between patients and particular specialists that may not exist in the space as we see
Absolutely.
it. Okay. So, thinking through that, then, what are some of the key challenges in providing accessible specialist care, and how do you address them?
Okay, so some of the challenges in terms of access could be one, financial.
Mm-hmm.
So let's start with that. So some of the ways, especially here at Doctors Hospital Health System, that we look at financial challenges is by creating programs that we're able to have patients participate in.
Mm-hmm.
And if for us, particularly our Loyalty Advantage membership program, our LAMP program.
Mm-hmm.
So our LAMP program, especially in the primary care space, and even in some instances, even pre-primary care, which is in the wellness space,
Mm-hmm.
offers those opportunities at a very low fixed cost to patients to be able to access our care. we're being more creative in the even when we get into the tertiary care
Mm-hmm.
areas in terms of the way we accept patients into the hospital and the way we take a look at insurance benefits
Mm-hmm.
in terms of self-pay rates. The other things that we're doing that might also help financially is putting in lower levels of care, like an observation unit,
Mm-hmm.
putting in or creating other forms of care like extended
Mm-hmm.
care and rehabilitation that may also help to mitigate some of the costs and actually also be more preventative in having patients require further levels of care.
Mm-hmm.
Then the other thing may be geographic. So we have our Family Island patients. They may have a difficult time accessing care in the capital.
Mm-hmm.
So Doctors Hospital Health Systems has decided to embark on an initiative called the EAGLE Initiative.
Mm-hmm.
EAGLE stands for Eleuthera, Abaco, Grand Bahama, Long Island, and Exuma. And as many people may know, we have already started with footprints in both Grand Bahama as well
Excellent.
as Exuma.
Mm-hmm.
So that in that way, really helping to mitigate again some of the geographical difficulties with
Right.
access to Doctors Hospital Health System and what the services that we have to offer as well.
Hmm. It's interesting you mentioned wellness. It's another topic that's come up a lot in the last few episodes of the podcast. And similarly with LAMP, we had the LAMP team on last week. So if you're unfamiliar with the LAMP program that Dr. Collie just mentioned, you can feel free to, when you're done with this podcast, go back and listen to the podcast from last week on the Loyalty Advantage membership program for kind of the full explanation of how that works. So from your perspective, Dr. Collie, why is specialist care important in the overall healthcare landscape? And what benefits does it offer to patients to have access to specialist care?
So specialists are physicians that are experts in a specific area of medicine.
Right.
And many patients require specific care. And these days there is a term we use in medicine called precision medicine.
Mm-hmm.
And so that's where we really focus in on exactly what's wrong with this patient, even in some instances down to the genomics.
Mm.
And so really many patients may have issues that require that level of complex medical treatment, diagnosis first, then treatment and care. So indeed, the importance of having access to it
Mm-hmm.
is for you to be able to sure you have your primary care physicians, but many times there are patients that require access to higher levels of care
Mm-hmm.
in order to facilitate their health.
Okay. Can you speak to some of the specialist services that are available within the health system? And then what factors influence the decision making in onboarding particular specialists?
So I'm going to start with the second part of your question
Sure.
first.
Mm-hmm.
So the way we make decisions on what's needed is because we collect lots of data
Mm-hmm.
on and demographic information as well on our patients. We have a wonderful electronic health record system
Mm-hmm.
that allows us to do this. And we look at the types of patients we're seeing on the inpatient as well as on the outpatient basis.
Right.
And that often will speak to what is needed to enhance the health or to assist with the health of these patients,
Mm-hmm.
whether it be cardiology, and I can speak to some of the specialists that we
Mm-hmm.
have in our system: cardiology, we have pulmonary physicians,
Mm-hmm.
gastroenterologist, rheumatologist, which is the care of bones and autoimmune diseases,
Mm-hmm.
endocrinologists that care for diabetes, thyroid diseases.
Mm-hmm.
We have obstetrics and gynecologists. We have specialized gynecology with our urogynecology,
Mm-hmm.
which is a specialist in gynecology, but with a combination of urology as well too.
Right.
We have urologists in our system for our men
Mm-hmm.
that require that level of care. We have sports medicine as well too,
Mm-hmm.
which is very important as we are, trying to become a sports destination
Mm-hmm.
and trying to keep our athletes safe and healthy. We have also in our care, wound care specialists and hyperbaric medicine.
Hmm.
Hyperbarics is that therapy. It's an oxygen therapy that's used for many different purposes, including dive injuries, but also including wound care.
Hmm.
And a lot of people also may want to use it for regeneration.
Hmm.
So we definitely have a slew of specialists. We're boarding podiatrists because, once again, in conjunction with some of the things that we're seeing in our rehab space,
Hmm.
we realize that some patients may have lots of foot issues that we're going to need to help with. So definitely, we have a slew of specialists, and most of the decisions is made on our demographics and our data.
Right. And it is interesting. Obviously, we've in our department, we engage with a lot of the physicians as we onboard them in these different specialties. So I know, obviously, in the recent past, in the past, I think 2 or 3 years, we added sports medicine, we added dermatology, we brought bariatrics back into the health system. We added our own ONG, like in-house specialists in the past few years. So obviously, it's something where we're constantly looking to expand what we're offering based on what you're seeing in the data, and
Correct.
what I guess what the community necessitates as it
Absolutely.
pertains to care. Um, so I want to move into a conversation about innovation. So can you discuss any innovative approaches that the health system has taken to improve access to specialist care, particularly for, and I think you may have touched on this a little bit, but maybe expand a bit more, but for underserved communities or remote areas?
So, most definitely. And this is of particular interest to us, our underserved and remote areas. So, you notice when I spoke about the Eagle locations, I named 5 islands. And of course, we have more than 5 islands in the Bahamas. But what we have come up with is advances in telemedicine.
Hmm.
And so we have a very robust telemedicine program because of our integration. And
Hmm.
I want to emphasize that word integration
Hmm.
because when you're a patient in Doctors Hospital Health System, your health record, your all of your health is integrated into one system.
Hmm.
So whether you're in Exuma, whether you're in Long Island, whether you're in Exuma, whether you're in New Providence, your health is integrated. And
Hmm.
we use telemedicine not only for primary care purposes, but we use telemedicine in the specialist area. So not only do many of our specialists fly to our clinics in Grand Bahama
Hmm.
and Exuma, but they will also reach out to other islands
Hmm.
as well through our telemedicine platforms.
Right. And so obviously that sort of innovation allows that access, going back to your original point, which is the importance of access. It expands that access beyond even just, New Providence and the
Correct.
major islands, so to speak.
Mhm.
And then I think, speaking to the even the concept of the health system, I imagine there's also the benefits of having all of the different services, even when you go beyond specialty care, being within the same health system. Because if you have something that necessitates rehab, your record exists in the same space. You have something that
Correct.
necessitates imaging or pharmacy or whatever additional services that are aligned with it. All of those, that record is consistent throughout all of those spaces,
Correct.
which I imagine leads to a more robust level of care and
Right.
attention to detail to make
And
sure that
better
right.
outcomes.
All right.
Absolutely.
So, great conversation thus far. We're going to take a quick break, and then we'll come back to finish off our conversation with Dr. Sheena Antonio-Collie about specialist care at Doctors Hospital Health System.
Let's face it, life is hard, but your healthcare doesn't have to be. Give yourself a peace of mind with LAMP plans at Doctors Hospital. Sign up today and enjoy the low cost advantage. Get up to $5,000 in credit limit for non covered services and 2 free nutritional consultations. Choose your plan today by visiting doctorshos.com/lamp. We make healthcare easy.
All right, so we're picking up our conversation with Dr. Sheena Antonio-Collie talking about specialist care within Doctors Hospital Health System. So I think we've talked a little bit about collaboration among specialists and things like that. But I want to zero in a little bit more on how that works to ensure comprehensive and coordinated patient care. So, again, going back to that concept of if you have a patient that has a fairly complex issue and you require a multidisciplinary approach, what does that look like in regards to specialist care within the health system?
Correct. And so that goes back to the whole idea of integration. So you do have a complex patient, whether that's in the inpatient or outpatient space.
Hmm.
When we talk about the collaboration between specialists and multidisciplinary, because you have a focus, one system where you can access that patient's information
Hmm.
and be able to collaborate colleague to colleague through the electronic medical record.
Hmm.
It makes patient care and patient care seamless and patient outcomes improved. So definitely bringing specialists together, whether they are physically in one space like our Centreville Medical Center
Right.
or Loudon Medical Center on Dowswell Street,
Hmm.
or the Doctors Hospital West specialist clinic as well too, as well as Freeport Medical Center, Exuma Medical Center.
Hmm.
So these are all the places that you can access our physicians.
Hmm.
But indeed, if you're an Exuma and your cardiologist wants something to be done for you, to you,
Hmm.
that integration and that collaboration between primary care, between specialists and specialist to specialists
Hmm.
are there to in order to foster the care for the patient.
Right. And I think you've mentioned this already, but one of the key components of that is obviously the intent is to seek better outcomes for patients.
Correct.
Right.
That is very huge.
Okay. We talked a little bit about innovation, specifically as it relates to telehealth. But can you tell us about any other advancements that you foresee coming down the pipeline as it pertains to how technology plays in this space, especially with regards to that access point of specialist care?
So definitely. So we have added to our armamentarium in the health system
Hmm.
a director of innovation.
Hmm.
And so he's responsible for answering those exact questions.
Right.
So whether that's access to care, whether that's using technology
Hmm.
to improve the care we're already giving, that's his portfolio. And one of the big things that's coming down the pipe would be artificial intelligence, so
Hmm.
AI. And AI also, there are tools available in the AI space that will allow us to improve our care delivery,
Hmm.
to especially specialty care delivery to our patients.
Hmm.
So AI, there are modalities in AI that will allow patients to access care from a health provider on their phones,
Hmm.
answering questions, and that would sort of tell you where to go, how to be referred.
Hmm.
AI in terms of preparation for surgery, AI in terms of imaging modalities
Hmm.
and what are the ones that probably will give you the best answers to some of your questions. So we are exploring all of those technological
Hmm.
advancements to see which would be the best suited for our patient population.
Right.
And so stay tuned for that.
Yeah, because I know there's a lot that we've done already in terms of
Correct.
just digitization alone,
Absolutely.
in terms of registration, filling out
Yes.
forms, application processes,
Absolutely.
engagement with providers,
Mhm.
engagement with registration, all of these different areas. I know we've also had a number of discussions about integrating AI even into our website
Yes.
to help people as they navigate the website to be able to find
Absolutely.
specifically what they need a lot easier.
Mhm.
So this is just kind of looking at that and saying, okay, how do we then take that into the patient care
Correct.
space, and how patients interact, even from a patient to provider standpoint.
Absolutely.
Awesome. So going a little bit behind the curtain on this question, but what strategies do you employ to recruit and retain specialist physicians within the health system, particularly in high demand specialties? Because I imagine we're a small country, and we don't have a ton of people, but at the same time, we are seeing an expanding list of complex and interesting, I think that the term that it likes to use in the medical field is weird and wonderful things
Yes.
that pop up. Sorry, this is the influence of my wife, who's a physician.
Yes.
But the weird and wonderful. So, I imagine there's always this idea of looking to see what we need in the system and where we can find it. So, what strategies do you employ to recruit and retain specialists in the health system?
So several. And so one of them in particular, definitely, like I said, using the demographics and the data that we have to speak to what our needs are,
Hmm.
and then reaching out to physicians. So we have a program where we reach out to, especially in those very highly specialized areas
Hmm.
where we don't even have local specialist.
Mm.
But what we do is we have a program where we reach out to the Bahamian diaspora in the United States, the Canada,
Hmm.
UK, Australia, wherever they may be, and we create a way for them to actually give that access to their specialization to the Bahamian public, which and I will tell you that most of our diaspora physicians are great. They want to come back and give back and to help the Bahamian community.
Hmm.
And so just opening the avenue for them to come back,
Right.
making sure that we are well equipped for them.
Hmm.
So our strategy is always to engage them, open the way for them,
Hmm.
making sure that we have the equipment, the personnel that would support them, and giving them support.
Hmm.
Sometimes that may be in the form of a telemedicine consultation.
Right.
Sometimes that might be in the form of them actually physically coming to the Bahamas and having clinics, or even seeing patients in the hospital during certain periods of time,
Hmm.
or having the patient referred to their clinic or their facility wherever they are as well too. So that collaborative, that collaboration is there.
Hmm.
And because they would, once we engage them, they're a part of our medical staff.
Right.
They're able to once again be a part of that integrated system, looking in on the patient's health status, able to track and follow the patients even when the patient's not in their
Hmm.
physical company.
Right. So I imagine there's a lot of that involves kind of keeping your ear to the ground and knowing who is in what level of training and things like
Correct.
that. Yeah, because
Yes.
I've heard of some very interesting things that people that Bahamians are studying abroad. I know there's a young lady who's studying. I can't remember the exact name of it, but it's the ability to do surgery on a fetus while still within
Correct.
the mother's womb. And it's like
Yes.
there's a lot of really cool and interesting things that
Hmm.
our own people are out there studying, and I imagine we would
Absolutely.
hope to be able to bring that sort of specialist care back into the
Absolutely.
country.
Yes.
So yeah, it's awesome to I don't know how you do it. That sounds like that in and of itself, the recruitment and retaining part, the retention part is a job in and of
Correct.
itself. In addition to everything else that you outlined at the top of our
Absolutely.
conversation. Um, so let's look at success stories. I think one of the things that people obviously would want to hear and would be interested in hearing about is how this turns into success for patients. So, are there any notable success stories or initiatives that the health system has implemented, or any patient stories that you can tell that showcase and highlight the critical nature of this specialist care, and especially anything that talks about that multidisciplinary approach.
So one of them that I can speak about, and although this is an inpatient example,
Hmm.
I will tell you that it extends into across the health system. And so baby J, I will call him,
Hmm.
came into the hospital extremely ill. Baby
Hmm.
J had already had open heart surgery, so he was already a special baby. Baby J came into our health system and he was dying.
Hmm.
And we are blessed to have a pediatric intensive care physician,
Hmm.
which is a highly specialized physician in our health system,
Hmm.
and a team of other specialists, cardiovascular, pulmonary, our perfusionists,
Hmm.
our critical care nurses, All of them were respiratory therapists working together to do some very extreme very, very extreme procedures
Mm-hmm.
on this child and working to get him to a higher level of care, which literally meant that they had to jump on a plane,
Mm-hmm.
all of them, to ensure that he was well until he was delivered very safely into the hands of the super specialized care that he required
Mm-hmm.
safely. And we received lots of commendations from that center saying how our efforts were the efforts that we gave really saved this baby's life. I
Mm-hmm.
received a wonderful picture and video from his mother just a month ago showing him running around
Mm-hmm.
doing very, very well,
That's
growing very,
awesome.
very well. And so things like that show the ability of our specialists to work together,
Mm-hmm.
the integration of care, the care that our specialists bring to our health system,
Mm-hmm.
just that ability to actually care that a patient has a great outcome.
Mm-hmm.
That's very important. And we never want to forget that one of our biggest mantras in Doctors Hospital Health System is high touch, high tech.
Mm-hmm. And high quality.
Absolutely.
Right. It's an amazing thing to hear because sometimes people say, oh, the whole concept of doing referrals or getting second opinions and all these things, and there's this idea that you know egos can't be set aside in pursuit of getting the best results for a patient.
Yeah,
So I think it's critical for people to hear about stories like that show that no, at the end of the day, what is most important and most critical is the patient outcome and ensuring that
absolutely.
the best is done for every patient that walks through the door,
Absolutely.
regardless of how complex or simple their case may be.
This is correct.
Okay, so wrapping up now, looking ahead, looking into your crystal ball, looking into the future, what do you see or what do you believe are the most pressing challenges and opportunities in ensuring access to specialist care within the health system? And then are there any unique ideas or initiatives that you have in order to address them?
So definitely the same challenges that we spoke about earlier.
Mm-hmm.
Um, the access to health financially continues to be a growing issue. Insurance companies are getting more tight in terms of their reimbursements, in terms of their ability or their would they pay. Patients have higher deductibles. Their co-pays are getting higher. So Doctors Hospital Health System continues to monitor this, to look at ways that we can facilitate the care of our patients. Some of it means that there are things that we're going to be doing internally that will be able to um, almost eliminate a need for a third party
Mm-hmm.
because of how very innovative we're going to be in terms of turning patients around and into the health system.
Right.
Definitely looking at wellness as a means of prevention, getting patients healthy or remaining healthy, and
Mm-hmm.
really making that a big part of our emphasis as well too in what we're doing. So definitely we are a great tertiary. We're great with our tertiary care,
Mm-hmm.
but we want to foster a lot in that space, in the wellness space. And so that's a growing issues. The geographical challenges we spoke about,
Mm-hmm.
and telemedicine is one of the big ones that we're going to do, as well as some other innovative ways with the use of technology such as
Mm-hmm.
AI to come alongside to get the patients on the remote islands to be able to access our care. We actually had an initiative a little over a year ago where we went to Mayaguana and signed patients up for LAMP.
Mm-hmm.
And, Mayaguana has 300 people on it.
Mm-hmm.
But what we find is that once patients understand that they're able to access care, I
Mm-hmm.
think then you're going to see a healthier community
Right.
because people will not have the barriers
Right.
that right now a lot of it and many times that barrier might be financial. we find less barriers when it comes to stigma because we don't have HIPAA in the Bahamas, but we are a Joint Commission accredited institution.
Hmm.
So we have adopted a lot of the HIPAA laws that govern with confidentiality
Hmm.
and patients, being able to come into our health system and not have their health records accessed by persons that they don't want to
Correct.
have them access to.
Hmm.
And so we are really continuing to foster ways to increase access, to look at what we're dealing with right now in our
Hmm.
community, especially after COVID, after
Hmm.
Dorian, where people are still feeling the sting from those things and coming alongside of them to ensure that your health, which is, as we say, worth it,
Hmm.
but you're able to also afford it.
Yes. Awesome. This has been a very interesting and great conversation. I think it gives me even a better appreciation for all that goes into the work just as CMO. And then obviously in trying to ensure that we have access to the specialist care, not just in New Providence, but across the length and breadth of the Bahamas. So I want to thank you. Obviously, I
You're
can tell that
welcome.
your role is a very busy one. So I want to thank you for taking time out of your schedule to come and talk with us and for our listening audience to hear all of the amazing and interesting things that are happening in our specialist space. So thank you very much for joining the show today.
You are ever so welcome.
And to our listeners, as always, we thank you for listening and we ask that you like, comment, subscribe, and share. And we will see you back here next week on the Doctor's Hospital Podcast.
Are you uninsured and seeking a plan that can give you quality health care at discounted rates? Unlock affordable health care with LAMP. Enjoy unlimited primary care visits, exclusive discounts of up to 20%, and complimentary imaging and nutrition services. Visit doctorshos.com/LAMP to register. Comprehensive, cost-efficient wellness starts with LAMP.